Columbus Small Animal Hospital, loving our work. I'm Dr. Jim Kramer. This is Maggie May. She's a 150-pound, 2.5-year-old spayed female American Bulldog cross. Here we are treating her with a Class 4 therapy laser. Class 4 therapy laser uses light energy to minimize pain, reduce inflammation and swelling, and to speed healing. Poor Maggie May got a puncture wound between her front legs, and unfortunately cellulitis has caused a large area of tissue to slough. And here she is looking happy. The problem is not completely resolved, but after only one treatment of Class 4 therapeutic laser, she seems quite happy and is doing very, very well. We are really pleased and excited to bring this new technology to this area.
The way the photons are applied to the tissue is going to be based on the condition that we're treating. We have the patented treatment heads, and I'll just quickly show you. These two are going to be your contact heads. These are going to be for mostly musculoskeletal conditions, where you're actually making contact with the surface of the animal. So on arthritic cases, that's going to come into play. For inflammatory bowel disease, bladder conditions, you're making contact because you need that deeper penetration to reach your target. The other two treatment heads, and power determines whether you use small or large, but these are off-contact treatment heads where you're going to be treating superficial conditions. So it could be a post-surgical incision site. It could be a dermatitis case where you're treating a large area on the animal. It can be for wounds. Wounds are very dramatic because they're right on the surface and you can see them. And after a few treatments, you can see the granulation in that tissue and the closure, and you see that wound start to shrink. So it's really amazing to see the results just after a few treatments. So it's photons. It's much like photosynthesis and the sunlight causing plants to grow. So it's very similar to that, and then it's stimulating that cell growth beneath the surface or on the surface for a wound or some superficial condition. This is doing what our bodies do naturally, only this is exponentially faster. This is speeding up the process. That's why professional sport teams and college sport teams love it so much, because it's a way to get that player back on the field in a shorter amount of time. I've heard stories of athletes, professional athletes, that were expected to be out for 3 months and possibly undergo surgery, that opted for this, and they were back on the field in as little as 3 weeks and no surgery. It's the most exciting, and it's the fastest growing technology in veterinary medicine. It's becoming more and more accepted. It's been out for several years now. We have the science. We've performed the studies and the research, the controlled studies, the double-blinded placebo studies, and documented all of that. So we know it's efficacious.
Columbus Small Animal Hospital, loving our work.